Now, around 1 in 5 people are not sure if they would get a coronavirus vaccine if one became available. Research from the Royal Society of Public Health found that 19% of people would be hesitant to get the jab, citing a belief that they already had immunity from having had the virus and wanting other people to have the vaccine first. Well, joining us now to discuss this more is the Chief Executive of the Royal Society for Public Health, Shirley Cramer. Really warm welcome to the programme to you. That's quite a high number, 20% of us with doubts.
We were really surprised about this because given the current situation, the lockdown, we would have assumed that would be much, much higher. And so the fact that 1 in 5 of us are a bit concerned about this, I wouldn't say necessarily vaccine hesitant in this case, because this is such a unique situation, but the fact that people have concerns and were willing to express them in this way. So, 81% said yes, they would absolutely definitively get a vaccine, but others had much more concern about the safety, the efficacy and the contents of the vaccine, and the fact probably that it's, being done quickly, and so the testing will be very different. So
that's something I wanted to ask you about specifically.
Yeah.
There's this enormous international pressure from all around the world to try and get this vaccine. Do people have legitimate concerns that shortcuts might be taken given the unprecedented pandemic?
I think it's weighing one thing against the other, and I think given what we know COVID-19 can do to the population, some of the heartbreak we've seen over the last couple of weeks, I honestly think that any vaccine would be certainly worth the taking of. And there are different, in terms of a vaccine that's going to be safe for the entire population, the vaccine experts have told us 12 to 18 months, which seems reasonable. But if you look at the way experts were able to very quickly expedite some vaccines around Ebola, for example, that means that for people who really need it, there's a new protocol that people could get it quickly if they were at risk, so like healthcare workers. So let's hope that a vaccine is made available for them more quickly. We know that there are about 70 different groups around the world looking at vaccines right now, so that's very, very encouraging.
Just on this vaccine and the issue of herd immunity, if, say, this 20% of people who have doubts decided not to take an approved vaccine, would they still be covered by herd immunity if 80% of us were inoculated?
It's different for different vaccines, so it would depend. It would really depend. In some cases, yes, in others, no. So I think what we ought to be doing really now, we know we're in this for the long haul, and therefore we should be looking at our messaging around vaccines right now, and we should be talking to the population, thinking about how we deliver it, thinking about access to it, because we know currently that there are certain groups of people that it's harder to reach than others, and we should be talking about safety, efficacy, the importance of a vaccine around this, and discussing it with the public. I think that would be really, really helpful for our long-term safety around the vaccine.
And not least because we're seeing, aren't we, a kind of rising mistrust in vaccines, which is alarming, frankly.
This is really alarming. Last year, I think the Wellcome Trust did some research and showed that it's one of the biggest global threats was people, particularly actually in Western Europe, being hesitant about vaccines and being much more sceptical. I mean, we lost in the UK our measles-free status last August, and therefore we need to make sure that our vaccine rates are as high as they possibly can be. And it is worth saying that in the UK, 93% of people have always said that vaccines, they really believe in vaccines, and we're one of the countries where historically we've had high take-up rates, and we must continue with this. So it would be really, really important, I think, for a coronavirus vaccine that we get on top of this and get the messaging right and start doing it early so that we prepare people for this and how important it is. Because honestly, getting out of this lockdown strategy without a vaccine is going to be very tricky.
And I suppose if you ever wanted an example of the importance of a vaccine, this corona pandemic is it. Shirley Cramer from the Royal Society for Public Health. Really good to get your thoughts this morning. Thank you very much.
Yeah.